That blood pressure chart in your doctor's office, the one that says you need to be at 120/80 or you are in danger, that chart was never designed for your body after 65. What most seniors do not realize is that blindly chasing a single number without understanding what is happening inside your aging arteries can be just as dangerous as ignoring high blood pressure altogether. I am going to prove it to you right now, and by the end of this video, you will have the real chart, the one that accounts for your age, your artery health, your diastolic number, and your individual risk. My name is Dr. Raymond Hollis, board-certified internist and geriatric medicine specialist, 22 years in practice, over 14,000 patients aged 60 and older. I have held the hands of patients who collapsed because their blood pressure was driven too low by medications they did not need at those doses. I have watched a 78-year-old woman fracture her hip because she stood up and her pressure dropped 40 points in 3 seconds. I have also lost patients to strokes that could have been prevented with smarter treatment. The one-size-fits-all approach to blood pressure in seniors is one of the greatest quiet failures of modern medicine. Let me destroy some myths right now. Myth 1. 120/80 is perfect for everyone. It is not. That target came from studies designed around younger, healthier populations. Myth 2. If your systolic is above 130, you automatically need more medication. That ignores your diastolic pressure, your pulse pressure, your standing blood pressure, and your frailty status. Myth 3. Natural is always better than medicated. Some people absolutely need medication and taking them off is reckless. But others are on 4 pills driving their pressure so low it is starving their brain. Myth 4. Blood pressure targets should not change with age. Your physiology at 68 is fundamentally different from 38. Myth 5. Diastolic pressure does not matter in seniors. This is the most dangerous myth of all. Most people think of blood pressure like a garden hose. Turn the faucet, pressure goes up. But your cardiovascular system after 65 is more like a city's entire water distribution system with pipes of different ages, some flexible, some rigid, and junctions that require minimum pressure to deliver flow to critical neighborhoods. When you reduce pressure at the source, without understanding which neighborhoods need that pressure, you create blackouts in the brain, kidneys, and heart. I am going to walk you through 4 mechanisms your doctor has never explained. First, arterial stiffness and pulse pressure widening, the real reason your systolic rises with age. Second, the diastolic J-curve phenomenon, a hidden danger zone where lowering pressure too much increases heart attack risk. Third, orthostatic hypotension and cerebral autoregulation decline, why seniors fall, get dizzy, and lose cognition on medications. Fourth, nitric oxide depletion, why your vessels lose the ability to relax after 60 and how to restore it. The pharmaceutical industry makes billions yearly from blood pressure medications. When studies show aggressive targets may harm certain seniors, that information does not spread the same way. There is no marketing budget behind, maybe you need less medication. Your doctor is not a bad person. They are operating inside a system that trained them on guidelines designed around younger populations, updated years behind the science. They have 12 minutes with you. They see the number, compare it to the guideline, adjust the medication, and move on. That is not evil. That is a broken system. By the end of this video, you will understand why your numbers mean something different after 65, the danger of diastolic pressure below 60, the real blood pressure chart, exact questions for your doctor, and a science-backed protocol shown in trials to lower systolic by 8 to 14 points without adding medication. This is not fear-mongering. This is science your doctor does not have time to explain. Stay with me because what you learn could change your life. Let me build the science from the ground up. Your heart pumps blood into arteries. The systolic number measures pressure when the heart squeezes. The diastolic measures pressure between beats, when the heart rests. Here is the critical part. When young, your arteries are elastic like new rubber bands. They stretch when the heart pumps, then recoil between beats, keeping blood flowing forward even while the heart rests. This is called the Wind-Kessel effect. But starting around your 40s and accelerating after 60, artery walls stiffen. Elastic fibers break down and get replaced by rigid collagen. Calcium deposits accumulate. Your arteries go from rubber bands to rigid pipes. This is arterial stiffness, a universal consequence of aging. A study in hypertension in 2005 by Mitchell and colleagues using Framingham Heart Study data showed aortic stiffness is one of the strongest independent predictors of cardiovascular events over 60. When stiff arteries cannot absorb each heartbeat's force, systolic pressure rises. Not because your heart pumps harder, but because rigid pipes cannot expand. This is isolated systolic hypertension, the most common form of high blood pressure over 60. And because stiff arteries lose their recoil, diastolic pressure drops. This is why seniors commonly read 150 over 60. The gap between those numbers, called pulse pressure, widens dramatically. A study in Circulation in 2001 by Franklin showed pulse pressure is a stronger predictor of cardiovascular events than either number alone over 60. Here is the treatment problem. Your doctor sees 150 over 62. Systolic is above 130. The guideline says treat. They add medication. Systolic comes down to 135. But the diastolic also dropped to 54. This enters the diastolic J-curve danger zone. The J-curve, documented in the Journal of the American College of Cardiology in 2009 by Messerly, shows that when diastolic drops below 60 to 65 in older adults, coronary event risk reverses and goes back up. The heart receives most of its blood during diastole. Push diastolic too low and you starve the heart itself. It gets worse. Orthostatic hypotension is when blood pressure drops when you stand. In young people, the baroreflex compensates instantly. In older adults on multiple medications, that system is too slow. Blood pressure drops, brain blood flow drops, and you fall. Data from the SPRINT trial itself, published in the Journal of the American Geriatric Society in 2018 by Sink and colleagues, showed age over 75 was associated with significantly greater syncope, hypotension, and fall risk. A hip fracture over 75 carries a 20 to 30% one-year mortality rate. That fall may have been caused by a medication that looked perfect on paper, and your brain needs 15 to 20% of cardiac output. It has cerebral autoregulation that adjusts blood vessel diameter to maintain flow. But in older adults with long-standing hypertension, the lower boundary of this system shifts upward. The brain needs higher minimum pressure. A study in stroke in 2016 confirmed this shift. Aggressively lowering pressure can push seniors below their brain's ability to maintain flow. The result is cognitive fog, memory problems, and fatigue everyone attributes to aging. The major trials, SPRINT, HIVET, STEP, were excellent. SPRINT showed targeting below 120 reduced cardiovascular events by 25% and mortality by 27%. But SPRINT excluded patients with orthostatic hypotension, dementia, diabetes, and those in nursing homes. The guideline was built on data from healthier, more robust seniors than the average person in my exam room. The guideline is not lying, but it is incomplete. Drop a comment below with your last blood pressure reading and your age. Every comment helps this video reach more people. Tell me where you're watching from. Now let me tell you about Margaret, 74, retired school librarian, married to Richard for 48 years. She walked 2 miles daily, cooked Mediterranean meals, did not smoke. Her doctor put her on lisinopril 20 milligrams and amlodipine 5 milligrams 4 years earlier. Blood pressure came down to 128 over 60. Looked like a success. But Margaret felt different. She described a fog. She told me, "I stood in the grocery aisle for 3 minutes trying to remember the word bowl." She had fallen twice in 6 months. Richard said with tears in his eyes, "I am watching my wife disappear. She was the sharpest person I ever knew." Her previous doctor ran brain MRI, thyroid, B12, everything normal. "You are just getting older, Margaret." I checked her standing blood pressure. Seated, 126/58. At 1 minute standing, 98/44. Her systolic dropped 28 points. Nobody had checked because her seated pressure looked perfect. Every time she stood up, her brain was being starved of blood flow. The dizziness, falls, and cognitive fog were not aging. They were iatrogenic, caused by her medication. I reduced her amlodipine from 5 to 2.5 milligrams, kept the lisinopril, and introduced the protocol I am about to teach you. At 4 weeks, her standing drop went from 28 points to 12. She said, "I feel like someone cleaned the windshield. I can think again." At 12 weeks, standing drop was 8 points, within normal range. Her mini-mental exam went from 27 to 29 out of 30. No falls. She told me, "I thought my life was ending. Turns out it was my medication." Margaret is not unusual. She is millions of seniors whose seated pressure looks perfect, while their standing pressure silently destroys their independence. I call it the vascular resilience protocol. 5 components, each connected to the mechanisms I explained. Component 1, dietary nitrate loading. As you age, the enzyme producing nitric oxide in your vessels, called eNOS, becomes less active. Nitric oxide tells vessels to relax. But there is a backup pathway. Dietary nitrates from beetroot, arugula, and spinach are converted by bacteria on your tongue into nitric oxide. A trial in hypertension in 2015 by Capil enrolled 68 hypertensive patients and found daily beetroot juice reduced systolic pressure by 8 points over 4 weeks, comparable to a first-line medication. Consume 250 milliliters of cold-pressed organic beetroot juice daily or 2 to 3 cups of high-nitrate greens. Critical warning: antibacterial mouthwash kills the tongue bacteria that enable this conversion. A study in Free Radical Biology and Medicine in 2013 showed chlorhexidine mouthwash abolished the blood pressure benefit entirely. Component 2. Magnesium optimization. Magnesium relaxes artery smooth muscle and regulates calcium channels. Up to 68% of adults are deficient, higher in seniors. A meta-analysis in hypertension in 2016, pooling 34 trials with 20,000 participants, found magnesium supplementation reduced systolic blood pressure, with larger effects in deficient individuals closer to 5 to 6 points. Use magnesium glycinate or taurate, 300 to 400 milligrams daily with dinner. Avoid magnesium oxide. It has only 4% absorption. If you are on a diuretic, your magnesium is almost certainly being depleted by the very medication supposedly helping your pressure. Component 3. Potassium-sodium ratio optimization. The SSSS trial in the New England Journal of Medicine in 2021, over 20,000 participants, found replacing regular salt with potassium-enriched salt reduced stroke by 14% and mortality by 12%. Switch your salt, eat more avocados, sweet potatoes, and leafy greens. Target 3,500 to 5,000 milligrams of potassium daily from food. If you are on ACE inhibitors or ARBs, have potassium levels monitored. Component 4. The gravity challenge. The baroreflex can be trained. Every morning before medications, sit on the bed edge 60 seconds. Stand 2 minutes with hand support. Sit 60 seconds. Stand 2 minutes. Repeat 3 times. 12 minutes. This trains your blood pressure regulation system. Most patients see measurable improvement in 6 to 8 weeks. Additionally, Walking 30 minutes daily was shown in a meta-analysis in the British Journal of Sports Medicine in 2023 across 15,000 participants to reduce systolic by 9 points. Component 5, Inspiratory Muscle Strength Training. A trial in the Journal of the American Heart Association in 2021 by Craig Head at the University of Colorado, 36 adults aged 50 to 79, found breathing against resistance 5 minutes daily, reduced systolic by 9 points in 6 weeks. The device costs $30 to $50. 30 breaths daily through resistance, 5 minutes. What breaks the protocol? Antiseptic mouthwash destroys nitric oxide conversion. Do not take magnesium with calcium supplements. Separate by 2 hours. Do not change medications without medical supervision. And do not skip sleep. A study in hypertension in 2019 found sleeping under 6 hours increased hypertension risk by 20%. I know the objections. If beets and magnesium worked, why would I need 3 medications? These interventions address underlying vascular dysfunction, while medications suppress the number. They are complementary. With improved vascular health, you may need less medication, meaning fewer side effects. My doctor says I am fine. Has your doctor checked standing blood pressure, measured pulse pressure, checked RBC magnesium? If not, the assessment is incomplete. I cannot afford this. Beetroot juice costs $2 to $3 daily. Magnesium costs 15 cents. Walking is free. Total $3 to $4 a day. Compare that to a hip fracture at $40,000 to $60,000 or a stroke hospitalization at over $100,000. The guidelines say below 130. The same guideline states that for older adults with comorbidities, clinical judgment and patient preference should guide decisions. 130 is not a universal target. It is a starting point. Harold, 81, retired mechanic, was on 4 medications with seated pressure of 118/52. His family thought he was depressed. His standing pressure was 88/40. We reduced to 2 medications, added the protocol, and at 12 weeks he told me, I watched the whole Tennessee game with my grandson without falling asleep. First time in over a year. Dolores, 68, retired nurse practitioner, had textbook pressure of 124/56 on 2 medications, but kept getting lightheaded. We added the protocol, reduced to 1 medication, and her lightheadedness resolved in 5 weeks. She told me, I prescribed blood pressure medications for 30 years and never once checked a standing pressure on a patient over 65. Thomas, 76, was getting confused at night. His daughter feared Alzheimer's. Standing pressure was 94/46. RBC magnesium was 1.6 below optimal. We reduced medications, started the protocol emphasizing magnesium taurate, and within 8 weeks, nighttime confusion improved 70%. His daughter said, I got my dad back. In U.S. medical schools, the average student receives under 20 hours of nutrition education over 4 years. A study in academic medicine in 2010 found the average was 19.6 hours. You cannot patent beetroot juice. You cannot patent magnesium. You cannot patent walking. There is no sales force teaching your doctor about potassium salt substitutes reducing mortality by 12%. I am not anti-medication. I prescribe them daily. But medication alone, without addressing vascular physiology, without checking standing pressure, without nutritional optimization, is incomplete care. Daily implementation. Morning. Do the gravity challenge before medications. With breakfast, have beetroot juice or a high nitrate smoothie. Take magnesium with dinner. Use potassium salt in all cooking. Walk 30 minutes daily. Do 5 minutes of resistance breathing. Track seated and standing blood pressure at home. Ask your doctor for RBC magnesium and kidney function tests. Expect mild stomach adjustment week 1. By weeks 2 to 4, improved energy and reduced lightheadedness. By months 2 to 3, 8 to 14 point systolic reduction and significantly improved standing stability. By month 6, a conversation with your doctor about potentially reducing one medication. This is not overnight. It is gradual, measurable, and real. Tell me in the comments, are you going to try this? Type, I'm starting. And has your doctor ever checked your standing blood pressure? Type yes or no. Share this video with your mother, father, spouse, the person at church who has been dizzy, the friend whose husband just fell. Subscribe because I am building a community of informed seniors who refuse to accept that is just aging as an answer. I am not telling you to stop medications. The HiVet trial showed 21% mortality reduction in treated adults over 80. Medications save lives. What I am telling you is medication alone is incomplete care. Here are 3 questions for your next appointment. Doctor, can you measure my blood pressure standing at 1 and 3 minutes? My diastolic has been below 60. Could my dose be pushing it too low? Can you add RBC magnesium to my next blood panel? Think about where you started. You believed 120/80 was universal gold standard. You now know arterial stiffness changes everything after 65. You believed low diastolic was fine. You now know the J-curve means diastolic below 60 can starve the heart. You believed dizziness was just aging. You now know it is orthostatic hypotension, measurable and improvable. You believed pills were your only option. You now know about nitric oxide, magnesium, potassium, movement, and breathing, all backed by top-tier trials. 1 meal at a time, 1 walk at a time, 1 breath at a time. That is how you rebuild vascular resilience. I want you to walk into your next appointment with knowledge, not fear. I want you to stand up without grabbing the wall. I want you to garden and cook and watch football with your grandchildren and find every word you are looking for. That is what I want for you. Start the protocol. Talk to your doctor. Take your health back. I will see you in the next video.